G'day, Josh Osborne here, the podiatrist from Stay Tuned Sports Medicine. As a keen runner myself, I know the frustration of pain or injury getting in the way of my training and fitness goals. One of the biggest causes for injury can be training errors. Increasing our volume, intensity, or frequency too quickly and not allowing our body enough time to recover can lead to tissue breakdown and injury. One of the things that I like to use, and one of the guidelines, is the 10% rule. What that is essentially each week you would increase your training by around about 10%. So to give you an example of that, if I was running 10 kilometers a week for the first week, then the next week I would run up to 11 kilometers for that week. Or if I was running 20 kilometers for 1 week, then the next week I would run up to 22 kilometers, and so on and so forth. Now everyone's body is a little bit different, so always listen to your body, because some people may not be able to do up to that 10%. Another thing that can affect our body's injury can also be our biomechanics. What our biomechanics is essentially the way our body functions and moves. Muscle imbalances or poor range of motion can potentially lead to increased loading in certain areas. Another thing can actually be collapsing and pronating through the foot. So if we have a look down at my foot now, so if I collapse the arch of my foot, not only does it affect the foot, but we can also see that my ankle is rotating and turning in. We have a full rotation going on of the whole leg, which that not just affects the knee, but it also affects the hip. And you can imagine if we're running and we've got this extra movement going on, that's going to lead to increased energy expenditure, and it's not going to be our most effective way of loading. We can get this, so again, looking at the knee, so if we turn this in here, we're going to get a misaligned leg. And what this can do is this can put a lot more stress through the knee, and we can lead to potentially patellofemoral pain with that patella sort of having maltracking. Another thing that can cause this is having a muscular imbalance of having a weak VMO or tightness of the lateral muscles in the ITB. Another thing that can cause injury or chance of injury can be our running form. So the way that we run can definitely affect the way our body is going to handle load. So a common thing that we see is that people that are overstriding are going to can potentially see an increased amount of forces running up the leg. So overstriding, so if we're running and we're landing all the way out in front, then what can happen is we're going to be getting a lot more braking forces coming back, a lot more force shooting up the leg, and that could particularly on that knee joint. So this can potentially lead to an increase in pain in our knee. One thing that we can do to help improve this is trying to reduce that stride length and trying to land more underneath our body. And one way of doing so can be trying to increase our cadence and increase the amount of steps that we're doing per minute. There you go. There's a couple of things that can potentially lead to injury. One of the things that we are now doing at Stay Tuned Sports Medicine is that we are doing running gait analysis and program prescription. If you would like to know more about this stuff, give us a call at the clinic at Baronia and have a chat to one of our receptionists. Thank you.